Okay, so today we're diving into something pretty huge, a proposal that wants to completely reimagine England's National Health Service. It's called Fit for the Future, and it's a 10-year plan that honestly promises a revolution in healthcare. And the people who wrote it, well, they don't hold back on why it's so desperately needed. And look, that's not me being dramatic. That's a direct quote from the plan itself. This isn't being sold as just a little update or a tweak. No, they're framing this as an existential choice for one of the UK's most beloved institutions. The stakes really couldn't be any higher. So, why such a dramatic, almost desperate call to action? Well, this whole plan comes right after an investigation that found the NHS is in what they call critical condition. You know the story. People can't get basic appointments with their GP or dentist. Waiting lists are just spiraling out of control. Staff are completely burnt out. And, this is the really crucial part, outcomes for major diseases like cancer are actually falling behind other countries. The system, as it is right now, is just not working. So, faced with this crisis, the plan basically says forget small tweaks. Instead, it's prescribing a radical overhaul, a complete break with the past, to build a new NHS, really from the ground up. At the heart of it all is a totally new vision. It's about shifting power directly to you, the patient. The goal is to create a system that's predictive and preventative, one that gets ahead of problems instead of just reacting to them. It's all about finally embracing technology, while, and this is key, holding on tight to that founding principle, that it's free when you need it. So how do they plan to make this vision a reality? Well, the entire plan is built around three core ideas. Three huge transformational shifts that are designed to fundamentally change how healthcare is delivered in England. The whole strategy really rests on these three pillars. First, moving care out of the hospital and into the community. Second, making that massive leap from an old-school analog system to a fully digital one. And third, pivoting from just treating sickness to actively preventing it in the first place. Let's break down what each of these really means.
Okay, so that first shift is all about where your care happens. The old model, the one we have now, is all centered on the hospital. You have different services working in their own separate, fragmented silos. The new model wants to push care out into local communities, creating these integrated teams that can give you continuous, coordinated support right where you live. The second shift, it's all about technology. And the plan is brutally honest here, calling the NHS a 20th century laggard that's just bogged down by bureaucracy and endless paperwork. The goal is to leapfrog all of that and become a 21st century leader, using AI and data to put the power directly into your hands. So what does that look like in practice? Well, a lot of this transformation is going to revolve around the NHS app. They want to turn it into the full front door to the entire service. Just imagine it, choosing your hospital based on their actual performance data, having video consultations, managing all your prescriptions, and even coordinating care for a family member, all from your phone. The plan sums up this whole digital dream with one really powerful phrase. The ultimate goal is to give every single patient a doctor in their pocket, giving you instant access to advice and total control over your own health journey. All right, that brings us to the third big shift, which is all about getting upstream of illness. I mean, the reality is people are living longer, but they're often spending those extra years in poor health. And there are huge health inequalities between the richest and poorest parts of the country. This shift aims to tackle the root causes of all that. They're calling this a national mission for prevention. And it includes some big headline-grabbing policies, like creating a smoke-free generation and a moonshot to tackle obesity. But it also has some really futuristic ideas, like a new genomic service to predict your risk of future illness, and even reward schemes to incentivize you for making healthy choices. Okay, so those are the big, high-level strategies. But what would all this actually look and feel like for you and me, for the average person using the NHS? A really key part of this new experience is something called the Neighborhood Health Center. The idea is to create a one-stop shop in every community. It would bring together GPs, pharmacists, mental health support, all sorts of specialists, all under one roof. It's meant to make getting care way more convenient and joined up. And this leads to a completely new way of thinking about where you get care, like a new hierarchy. It starts with what's most local and digital by default. If that doesn't work, then care in your own home. After that, you go to the neighborhood health center. A trip to the hospital, that becomes the absolute last resort, not the first stop. It completely flips the old model on its head. And here's the bottom line, right? This should lead to real, tangible benefits that fix the things that drive us all crazy.
The plan explicitly promises an end to the 8 a.m. scramble for a GP appointment, and it gives patients the power to choose their hospital or specialist based on transparent quality data, not just on where they happen to live.
Of course, a vision this grand isn't going to happen on its own. You can't deliver it without rebuilding the very foundations of the system, and that means fundamentally changing how the NHS is staffed, how it's run, and how it's paid for. The workforce challenge is just huge. Right now, the staff sickness rate is 5.1%, which is way higher than in the private sector. The plan's answer isn't just to hire more people, it's to slash this rate by making the NHS the country's best employer, with better support, better training, and better career development.
And then there's the money. The NHS already eats up a massive 38% of all day-to-day government spending. I mean, think about that. Almost 40 pence of every pound. With a number that high, the idea of just pouring more and more money into the same old system, well, it's just not seen as sustainable anymore.
The plan itself declares a major shift in philosophy. It actually states that the era of the NHS's answer always being more money, never reform is over. The new focus is all about delivering better value and better health outcomes for every single pound that's spent.
So, where does that leave us? We've got a plan that is nothing short of a radical reinvention. It promises an NHS that's controlled by patients, that's technologically advanced, and that's focused on prevention. The vision is bold, the ambition is absolutely huge. The only question that's left, the billion-dollar question, is can it actually be delivered?